893 words, within the 900 plus or minus 5% target. Here's the complete script. The Google Health Sweep is still pulling your medical data right now, and HHS can't stop it. It runs quietly through Fitbit, through Google Health Connect, through every symptom you've ever typed into search. Health and Human Services opened an investigation into it. They closed the case without a single fine. The sweep never paused, not for one day. Here's the audit trail they didn't want surfacing. Officially, this started as something helpful. Google bought Fitbit in 2021, promising in writing that your steps and heart rate would stay walled off from ads. Around the same time, Google struck a deal called Project Nightingale, pulling patient records from Ascension, one of the largest hospital chains in the country, to build search tools for doctors. Health Connect followed on Android, a single pipe built to let health apps share data with each other so you wouldn't have to enter your weight into 5 different apps. On paper, 3 separate, harmless systems, each with its own privacy policy, its own engineering team, its own compliance sign-off. In practice, they were never separate. The architecture was built to eventually talk to itself. Here's what the sweep actually does. Every symptom you search gets logged with a persistent identifier tied to your Google account, time-stamped, geotagged, kept indefinitely. Every Fitbit reading, your heart rate, your sleep, your cycle tracking, your oxygen levels while you slept last night syncs through Health Connect into that same profile. Your location pings near a pharmacy, an oncology center, a fertility clinic, then quietly matches against the search you ran an hour earlier. None of it individually looks medical. Together, it's a shadow health record more detailed than anything your actual doctor keeps on file. No hospital authorized it. No patient signed a consent form for it. It's built entirely from behavior Google already legally collects for advertising, then silently cross-referenced against biometric data most people assume is private. And it's still running on your phone right now while you watch this. HHS did investigate. In 2019, after whistleblowers at Ascension leaked internal documents, the Office for Civil Rights opened a formal inquiry into Project Nightingale. Patients hadn't been told their records were leaving the hospital. Reporters called it the largest unauthorized medical data transfer in history. Investigators reviewed the contracts. Then in 2020, they closed the case. No violation found, no penalty issued. The agency meant to protect your medical privacy looked directly at the sweep and walked away. And here's the part nobody reported. The regulator already knew exactly why it couldn't win and said so in the file. HIPAA only governs covered entities, hospitals, insurers, and their direct business associates. Google structured itself as Ascension's vendor, not a healthcare provider, so the hospital-side records stayed technically compliant on paper. But search queries, Fitbit metrics, and location pings were never medical records to begin with. They're ordinary consumer data, sitting entirely outside HIPAA's jurisdiction, protected by nothing more than Google's own privacy policy, which Google can rewrite whenever it wants. HHS can only police the hospital side of the pipe. The moment your data crosses into Search or Health Connect, it enters a jurisdictional dead zone, legal for Google to hold, legal to combine, legal to keep forever, legal to hand to a data broker. 3 individually compliant systems, stitched into one profile that no single agency has the authority to touch. That's not a loophole regulators missed. It's a loophole they identified in writing, inside the case file, right before closing the investigation anyway. The FTC technically could act on the advertising side under its unfair practices authority. It hasn't opened a case. Nobody owns this gap. That's the mechanism. That's why the sweep can't be stopped, only watched. So think about what's already inside it. If you've ever typed a symptom into Google, worn a Fitbit to bed, or opened Maps to find a clinic, you have a file. It doesn't say diagnosis. It says user showed elevated interest in cardiac symptoms, frequent proximity to oncology facility, irregular sleep pattern consistent with treatment, search pattern matching early pregnancy. Inferred, not diagnosed, which means it's not protected health information under any current law, no matter how accurate it is. That inferred profile can be used to target ads. It can be bundled and sold in aggregate to data brokers. Insurers building actuarial risk models increasingly buy exactly this kind of aggregate behavioral data, legally, because it never technically touches your actual medical chart. The record HHS was built to guard never included this version of you. This version was never covered to begin with, and it's still being written, one search at a time. So who actually benefits from a health profile no agency can regulate, built from data you generated just by living your life? Not you. You never see it, never approve it, never get a chance to delete it. Google benefits in ad revenue it never has to disclose as health-related. Whoever eventually buys the aggregate data benefits without ever needing your name. The sweep is still running as you hear this, still logging, still syncing, still pinging, cell tower to cell tower, app to app. HHS closed its file in 2020. Nobody reopened it. No hearing was scheduled. No deadline was set, so who's watching it now? Save to script Google Health Sweep, TXT in your home directory.